To learn more about the program and what the donation will mean, we're joined by Manuel Gattuso. She is a breast cancer survivor who, along with her husband, Alan Slate, donated $12.5 million to the Princess Margaret Hospital's Breast Cancer Rapid Diagnosis Program. Ms. Gattuso, thank you for joining us. We appreciate it.
Thank you for having me.
This is an incredible contribution that you and your husband have made. How does it feel as a breast cancer survivor to know that you and your husband have been able to make this contribution, provide this kind of change and difference for so many women?
Well, it's difficult to describe in words. It just feels absolutely fantastic. It feels incredible. And I think that the most important thing in all of this is that Dr. David McCready, who first dreamed up this project, this program, I think the program is going to change the way the medical system deals with patients, and I think it's going to become much more patient-friendly and patient-oriented. So I think that's a very innovative concept in our medical system, and Alan and I are very pleased to, be able to be part of it.
Right, and I'm sure there's many Canadians, many women also, who are just so happy and so grateful to see this coming to fruition. How quickly will this change in terms of, eliminating the kind of weight that many women do see when they're trying to get that diagnosis?
Well, the pilot project started in 2006, and for a year and a bit more, the pilot project could receive 3 women a week. That was one day. Now we've raised some more money, and we've now up to 6 women, and sometimes 8 women, depending on the severity of the cases. And this will escalate, and we're hoping that by the end of the program, and when we will have raised all the money, we'll be able to serve 3,000 women every year in Ontario.
Mm-hmm. And this is, through this project, this would be the only hospital in the country where you could get that same-day diagnosis. Is that right?
Well, we're already receiving a lot of interest from other sister hospitals in the GTA all over the province. Mm-hmm. And frankly, I'm hoping that other hospitals in other provinces will also join the fray.
Yeah, so you're hoping it's sort of a revolution of sorts, right? That it forces change right through the country and right through many hospitals. But of course, that does depend on money, especially with an economic downturn. There are huge challenges, so it's a very timely donation for sure. Can you share your personal story? I mean, how important is it to reduce these wait times to get diagnosed?
Well, it's very important, and my experience was the same as most of the women and men and women who are diagnosed with cancer. It's the wait times between finding out that there might be a problem and knowing exactly what your situation is going to be, how you're going to deal with it, how it's going to affect your family, how it's going to affect your friends, how it's going to affect your work. Mm-hmm. It's incredible. It's a merry-go-round of emotions that are difficult to explain, but it can be pretty terrifying.
I mean, and that stress doesn't help someone who potentially, is going to be engaged in this battle, right, to fight that kind of a condition.
Absolutely, and I think that is what is so innovative about this rapid diagnostic clinic, is that it not only deals with the medical problems of the patient, but also the emotional problems and experience that the patient has to go through.
By the very nature that it's a one-day process, or by other support mechanisms, do you mean?
I'm sorry?
When you say there's other supports, or that it eliminates some of that stress, are there other supports apart from the one-day diagnosis that are part of this program as well?
Well, no, the whole idea of the program is that a person can walk in the morning, be referred to the center, walk in the morning, mm-hmm. get all the tests that need to be done, including tissue biopsies if needed, and by the end of the day meet with surgical oncologists and know exactly what the treatment plan is going to be.
Yeah, and that's huge, right? Because, how complicated is it to get that treatment plan for a lot of women? Again, that entails more time, right?
It entails a lot of time, and, we're probably very privileged here in Toronto. In other parts of the province, and certainly in other provinces, it can be, the wait time can be much longer.
So where do you want this to go from here? I mean, obviously this is such a big difference, again, for so many women's lives to get this one-day diagnosis, which is just phenomenal. But beyond that, I mean, what else would you like to see? We spoke about getting this in hospitals right across Canada, but what more do you think can be done, needs to be done?
Well, my dream and my hope is that if it works for breast cancer, why couldn't we apply it to other types of cancer? Why couldn't we apply this to any kind of cancer anywhere in Canada, in any cancer center? And, you know, nobody's told me yet that that was a completely ridiculous idea, so I still, you know, think about it.
Right. So more optimism and more hopes for beyond this. I just want to ask you, though, I mean, this is all in part due to a new technology that is able to offer this so quickly. Can you speak a little bit to that?
Well, I'm certainly not an expert on the technology, but we at Princess Margaret have acquired a piece of equipment called the rapid tissue processor, and I really can't explain to you how it works except to tell you that instead of taking days to be able to analyze tissue biopsies, it can do it in a matter of hours.
Right, and it's all thanks to that technology, and of course a very generous donation by yourself and your husband, and we want to thank you for taking the time to explain some of it to us. Emmanuel Gattuso, a breast cancer survivor and also the donor behind this initiative. We do thank you.
Thank you so much.